This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome, folks. Dr. Charles Parker here one more time at Core Brain Journal, and we have another interesting, very unusual guest in the sense that we really haven't taken this topic on in any respect whatsoever in our history with Core Brain Journal. We've been running for 9 months now. We have people listening to us in 83 countries, so we're busy with what we're doing. And I think the issue isn't me, it's we. What's happening is we're having conversations that are meaningful, useful, and worthy of further exploration. It's not me coming in and say, hey, Parker's right, but there is something to say that we need to have these conversations. And today is a very excellent type of example is the word I'm looking for this very topic. So Maureen Fura is going to be with us. Maureen, welcome aboard.
Hi, thanks for having me.
So Maureen is a multifaceted woman with a variety of issues that she's been involved with, but one of the main issues that she has is she's directed, produced, and put together a film called The Dark Side of the Moon. And it has to do with women, pregnancy, postpartum, and a variety of hormone issues that are going on with women in the country, indeed globally, that are sometimes not accurately diagnosed and treated. And we're going to talk about that. So let me introduce her a little bit. So Maureen's an inspired change maker. She was ingrained by the words of her mother to leave a better place than she found it. She's enjoyed an amazing career path that has her served as AmeriCorps, Peace Corps, Crisis Corps volunteer, founded a nonprofit organization. She launched a consulting group and works as one of 4 to create a digital media space for a graduate institution. So she's not only been out in the street, but she's doing her digital work really well. And so I'm going to read these to you. Now, this is, fasten your seatbelts, but she's been involved in advocacy, assessments and evaluation, budgeting, data analysis, grant management, project design, proposal writing, resource acquisition, staff supervision, strategy, and training. It's a mouthful, almost couldn't get it out. And so she's really a very interesting woman, and she put this film together. And really what we're going to hear about is her personal narrative, and we're going to take it into some other places that are referential from her own experience, because she's now, in one way or another, a spokesman for individuals who have suffered, women who have suffered with these variety of hormonal ups and downs that are really not adequately recognized and frequently overlooked. So let's tell us a little more, if you will, Maureen, about how you got on this path in the first place, please.
Wow, it was a lot. So I was in graduate school. I was 32 and had been recently married with my husband. We were newlyweds, and we were living in Monterey, California. And I had been, like you had said, I had been in Peace Corps and Crisis Corps. Like, I had done a lot. I had traveled cross country many times. I thrived on things that you didn't always know what was coming next. So this one morning, I remember waking up and I thought I had the flu, and I just felt foggy, and I grabbed some coffee. I had a Spanish class later that morning, and I was sitting outside, and as I'm like sipping my drink, and my thoughts just kind of wander, and there was this line that where I was normal, and then all of a sudden my whole life changed with a thought. And as I was sitting there, I look up into the tree behind me, and I can see myself hanging in the tree with a rope around my neck. And gosh. I had never, ever had a thought like that ever in my life. I had always been safe in my thoughts. I had never had a mental health diagnosis. like I said, I thrived on new things, and an hour later, I found out I was pregnant, and I couldn't help but think like I was normal, and then I wasn't normal, and how that was right at like the 2-week mark of being pregnant, right when those hormones start to spike, and I kept thinking this is related, and from that one thought of like, I see myself hanging in a tree. What if I kill myself? What if I tie something around my neck? It just spiraled, and it happened so fast. And within days, I went into a severe depression because the thoughts wouldn't stop in my head. Like, they were these constant ones, like one thought every second. Like, what if I kill myself? What if I drive off a cliff? What if? And they wouldn't stop. So I plunged very fast and very deep into a depression that I had never felt in my life, where just the thought of breathing felt really painful, and where thinking that it would always get better, that inner voice that I had always had for 32 years was gone, and the voice was saying, it's never going to get better, and this is it, and this is, as you know, it's just going to get worse. And I just couldn't help but think like that it was connected to this pregnancy, and I became an agoraphobic within a week. I couldn't leave my house. I couldn't drive. I remember my mom came out to help because I ended up in the ER because I thought I was going to kill myself, and they made me promise that I wouldn't do it, and I said, I just don't know what's happening to me. I just feel like I'm going to run into the bathroom and take a bunch of pills. Like, I didn't trust myself. And I told my mom one night, don't make sure you lock your door, because I might wake up in the middle of the night and kill you, and I'm not going to remember. Like, those are the kinds of thoughts I was having. Like, I was so terrified of myself. And my mom was like, oh my God, like, what is wrong with you? And I just said, lock your door, because I don't know if I'll wake up and do something that I won't even remember. I told the OB at my 6-week checkup, I've been being watched all this time now. And I said to her, you know, I don't feel like myself. I'm sad. I'm really sad. And she didn't even like wait for a pause. She just said, you know, you should be happy. You're having a baby. And I just felt so deflated. And my husband's sitting there, and I was thinking in my head, I'm waving a flag to you. Like, that wasn't the right answer. Like, I don't know what the answer is, but I'm pretty sure that wasn't the right answer. And I went to 29 different care providers over the next 4 months asking for help in different ways, and nobody knew what was wrong with me. I just kept saying I was normal one day, and then I wasn't, and that day I found out I was pregnant. And I think it's the hormones. And all I kept hearing was, well, postpartum, this can be an issue. Well, postpartum. And I kept thinking, I might not be here postpartum. Like, I don't think I'm going to make it to the end of this pregnancy. And, I mean, talk about, I went to social workers, I went to therapists, I went to psychiatrists, I went to OBs. I just kept getting the craziest responses, and doors shutting, and just being told, watch this in postpartum. But I couldn't even be in a room by myself. I couldn't be left alone. I just didn't trust myself.
Maureen, I've been doing psychiatry now for 45 years. And as we were talking about before we started the interview, I've interviewed a number of women, and I'm very preoccupied about hormone issues in women from the point of view, I know it contributes to their brain health or illness. We just see it happen all the time. And I've never heard a story like that. I've heard people have difficulties, but I have never heard that rock fall so abruptly and quickly immediately after pregnancy. And you know, the issue is really, I would say to myself, I probably haven't asked the question correctly, because the very fact that it's happening like this with you, and I know that estrogen dominance and estrogen problems occur with women, you just went right off the edge of the diving board right there with that hormone shift.
For sure. That influx of those hormones just completely threw me overboard. It like short-circuited my brain really fast.
So let's take a little look at this, because now I'm going to put my psychiatric hat on a little bit, if you don't mind. And you've been so forthcoming about this, but now I'm really even more interested in, I would say to myself, if you were in my office, what the heck did I miss? Because somehow I missed something. And let's take it back and talk about your hormone history, if you will, a little bit. So how old were you when you started your period, Maureen?
I was about 13.
Good age, standard age. We see girls that start at 8 years old now. We see many that start 17, and we've had one recently who was 18 years old. And what happens is women rationalize why their periods are off. You know, my mother had this, or I'm an athlete. So that whole thing of when it starts, that's pretty much on the button as far as my reading goes and my experience goes. Did your periods, did they begin reasonably well, or did you have trouble as you started your periods?
No, they were completely normal. Completely normal.
Okay.
Yeah.
And did they have a turn? So you would, when you had your period as an adolescent young woman, you didn't have any heavy cramping, heavy flow, breast tenderness, anything like that?
Not bad, but I did start to experience PMS probably in my 20s, where I became very sensitive to it. Like, I could feel my body shift. I could feel I could feel the change when the hormone would change. I could feel myself getting agitated. I could feel that in my 20s. Like,
now, when you did that, was that mid-cycle, or was that close? Was it like 3 days away from your period,
yes.
or was it mid-cycle?
Yes, 3 days away.
I got you.
And sometimes I would, get, like, I would feel low and have to get in the bed. I would always know that it would get better, but I would need to, I would withdraw.
So you had a depressive, vulnerable aspect to it, that you were much more vulnerable during that period of time.
Yes, and when I went into the Peace Corps when I was 22, it was the first time I had ever lost my period for 6 months. And I think it was from the stress, like all that stress of going into a country, not knowing the language, being left in a village all by yourself. And I remember thinking, I've never lost my period before like this. And I started to get panic attacks when my period stopped coming. So I figured these two things were connected.
Did you have any other signs?
Period.
I'm sorry, go ahead. What did you say? I missed that, what you said.
Oh, well, just the 6 months of losing the period. And then I'm thinking there was just a lot of cortisol being pushed in my body. I think I might be really sensitive to the stress hormone.
That sure sounds like it. So then, did you have any other signs of like acne, hair in places you don't want it? You didn't have any
not until I was 20. So a little backstory. When I was 19, I got pregnant, and I gave birth to a baby girl when I was 20 and placed her for adoption. So as soon as that happened, and it was a regular pregnancy, but as soon as after that pregnancy, I started to get like hair on my chin, and I started to get those very sensitive periods.
Mm-hmm. So that first child threw you over it was the beginning of the hormone deterioration, if you will.
I totally buy that, yes.
So then, apropos of that deterioration, so then your periods became more problematic after that first pregnancy?
Yeah, so really sensitive to PMS, and then the facial hair, and then like 3 years later, losing my period for 6 months.
Well, let me ask you this. In that period of time, there's a phenomenon where a lot of women don't talk about this, but they can actually feel ovulation take place in mid-cycle. So.
Oh, yeah.
Well, see, you say that very affirmatively. A lot of women like, what the heck are you talking about?
No, I've probably felt that since that age up until now.
Yeah, that's called Middle-Schmerz phenomenon.
Oh.
And Middle-Schmerz is directly related to the thickness of the follicle on the egg on your ovary. So what
Okay.
happens is if you're estrogen dominant, that follicle thickens. And then as it thickens, then it becomes more innervated, I expect. I'm not an expert on this, but it makes common sense when I'm talking to you. And then they feel the egg pop. I've had women have to go to the emergency room to ovulate.
Wow.
Because there's just so much pain, because they are really suffering. And when you do an ultrasound with them, I don't do ultrasound, I'm saying when they have one done, they find out that there are cysts on their ovaries. And the reason for the cysts is because those follicle coverings are so thick, the egg doesn't rupture properly, whereas a woman who isn't estrogen dominant has a thin covering and then can ovulate without feeling it. So some women ovulate, they don't even know they ovulate. A lot of women are that way. But a woman like yourself, this was a sign. You and I were talking earlier. We didn't get this specific about it, but this would be a sign of a imbalanced hormone system early on. You know,
I would believe it. I mean, the fact that my period would stop for 6 months, I think is odd.
yes.
And, right? Wouldn't that mean an imbalance?
Yes, it would.
At that age, at
yes,
24.
And I think this happens with women who are athletes too. A lot of times that is a stressful thing. Women who row crew, for example, are runners and get into very strenuous athletic events. The stress comes up and their periods do change. So back to it. So when you then were experiencing the Mittelschmerz phenomenon, did you have some acne as well, which is another sign?
I mean, I just get that, like, if I get like a pimple on my ear, it's like 3 days before, but I don't get like massive breakouts. There's one that happens right on my earlobe, and then I know, oh, okay, yeah, it's coming.
Here it comes, yeah. Women can get it on their chest, their back, their face. They can be really troubled. Women with PCOS, polycystic ovarian, can have very significant acne problems. And it just gets worse over time. And then what happens very frequently when they're adolescent women or young adults is they get on birth control. And then when they give them birth control, it can go either way. It can be helpful, and most of the birth control is estrogen dominant. But if a person's that estrogen dominant, give them birth control, they say, look, I can't take birth control. I get crazy with it. I just completely lose it. And were you placed on birth control yourself?
You know, I was placed on birth control, I think, 2 different times in my 20s, and I did experience that. I told the doctor, like, oh, no, I can't. This makes me feel like I'm not in control of my emotions. So I got off of it pretty fast, crazy, but not to the extent that I felt when I was pregnant the second time, but definitely, like, I could feel the difference, and I didn't like messing with my hormones like that.
Yeah, and so that's another sign as you're going down the path. And then then what happened is, it sounds like what happened, you were not fully conscious of these because you were a brave woman saying, look, I've been in the Peace Corps, I can handle things, this is just the period, I mean, I can deal with this. And then what happens, that sign is diminished as a significant sign until your mind actually changes.
For sure.
So did your period become irregular as well, Maureen, or did it stay the same? Did it stay regular?
You know, when I went into graduate school, I got pregnant about 7 months before I got into grad school. And that period of being in grad school, I had lost my period 2 different times from stress. The second time was right before I got pregnant with my son. So January, I didn't have a period. February, I didn't have a period. So something was happening. And then I found out like April 1st that I was pregnant with my son. So I got a period in March. So the periods were irregular right in that grad school period, right before this massive depression and OCD.
So, and when you say, for how long was that? Was it like 6 periods? Was it a year? Was it 6 months? What was it?
No, I must have lost like 4 different periods within 7 months.
Yeah, so you can see that the swing is happening. Isn't that interesting when you reflect on it?
Totally. Red flags everywhere.
And so then, but to have the disintegration that you had with the dramatic cognitive changes of seeing yourself hanging in a tree, that is very, very unusual. And, then to have all the disappointment of talking to people, because this is what's going on. This is the reason we're doing Core Brain Journal in the first place, Maureen, is to talk to individuals like you, because you're not alone out there. These kinds of things go on a regular basis in terms of denying the relevance of what you and I are talking about right here. And I'm not an OBGYN person. I'm saying this, I know it because I've asked it so often, that when you see this, you have to start thinking about what are the solutions for this problem. Because if you have any kind of, this isn't a premonition. This isn't something that's based on speculation. This is a real, firm, clear-cut clinical condition that's presenting itself as a symptom that has physical and, importantly, psychological meaning.
For sure.
It's amazing.
For not just one life, the mother, but also for her baby that's inside of her or just being born.
Absolutely.
It impacts
yeah,
too.
Absolutely. Now I'm going to ask you a more personal question, which I didn't prepare you for, okay? But since you're being so completely honest.
I know. It's a fault.
Tell me if you don't want to answer this question, okay? Because it's a little personal. I'm going to tell you now, some of my listeners know one of my favorite questions is this question, okay? And that is, did you have any kind of a bowel function problem through your life, specifically frequency of number 2? That's one of my favorite questions. How many times a day do you go number 2? Now.
I think twice.
So you're usually twice. Were you having a slowing of your bowel function?
No, I don't think so. If I did, I don't remember, so it wouldn't have stuck out. I don't think so.
Well, what
pretty
happens
regular.
Is, the reason I'm asking is because a lot of these deteriorations with these estrogen imbalances occur in the context of immune system dysregulation. So if a person has a relative constipation, and they can, and a constipation, I've had women go, I just evaluated somebody yesterday, and she was quite deteriorated, and she said, well, pardon me, for a long time, I would go anywhere from once a week to once every 3 weeks. And when you have the slowing of the bowel like that, and she had an immune system dysregulation with a food sensitivity, that changes the estrogen balance, because the estrogen isn't passing out of the bowel, it's actually being reabsorbed by the body.
Wow. And
so that's why I asked that question. And that's,
no, I didn't have that.
That's another key sign. So then what happened? How did you actually resolve this? I mean, we have you now in this terrible quandary. What did you do? What happened?
I found a psychiatrist in Los Angeles who put me on 50 milligrams of sertraline, so an SSRI. I was 6 months pregnant, probably wasn't going to make it to the end of the pregnancy, or was going to take my life soon after I had my son. With the 50 milligrams, the intrusive thoughts, they still fired rapidly, but there was a little bit of a lag between the thoughts. So maybe now, instead of once every second, it was like once every minute. So there was a little bit of a break. I stopped the crying every day. I could actually leave the house with the 50 milligrams. The thoughts were still there. And then I tried to see another psychiatrist because I moved back to Monterey, and that psychiatrist told me that they would have to talk to my OB because they couldn't treat me. It's like, okay, well, I won't be here. So then I found a great therapist who put me in touch with a nurse psychiatrist, a nurse practitioner, and she was able to get me on a good dose of sertraline, and she said, we can't stop until we get you back to who you are. And so we kept increasing the sertraline to about 150 before I delivered my son. And at that point, the thoughts were gone. I could sit in cognitive behavioral therapy. I wasn't even feeling those thoughts of the OCD brain weren't happening. The what ifs, they had completely stopped. And I was myself again.
Well, that's interesting because when, another thing that was your child, how did your child do post-delivery? Was it a boy?
So it was a boy. He
Yep.
did great. I mean, he was fine. The one thing that has happened to him is he was diagnosed with a rare social anxiety at the age of 5 called selective mutism. And I believe it's from the cortisol exposure. And I've had 3 children, and he is the only one that has some kind of anxiety. And he is the only one where I had a pregnancy that was
Troubled like that.
so stressed, yeah. And also he was exposed to sertraline at 150, but I had my 3rd son, and I was on 100 milligrams the entire pregnancy, and he does not have anxiety at all.
Well, the reason I asked is because there's a whole literature about the children. If you stop sertraline cold turkey, you could very easily have a downregulation and withdrawal syndrome.
Well, I breastfed because it was one of the safest drugs to breastfeed. So
there you go.
But I see what you mean, though. Like,
Yeah,
he would be out of utero.
Discontinuation syndrome.
But he did have the social. He does have the anxiety. That was my gift to him, or from his OB.
He very likely will get over it. I mean, what's going on in neuroscience is so amazing. I mean, somewhere in there, he's going to get measured up, and you're going to figure out what the whole thing is.
That would be great.
Not to plug Dr. Walsh, you really need to listen to the methylation recording that we have here. The interview I had with Dr. William Walsh at Core Brain Journal 025, because that's our most frequently downloaded of all. We've done more than 80 of them now, and that's the most frequently downloaded interview because it talks about molecular and cellular physiology of depression and how neurotransmitters are formed and recirculated in the synapse. It's terribly interesting.
Wow.
And the issue is to know that there are measurement tools that offer a lot of hope for people out there when you start looking at some of these complex situations that look like they're intractable and that you really can't do anything for them.
Oh, that's great.
So yeah,
I'll be listening to it.
You'll get a kick out of that. And he's such a good guy. He's salt of the earth, regular Midwest. He's from Naperville, Illinois, right outside of Chicago. And he was originally worked in Argonne National Laboratory up in Chicago, and so he's a very deep guy, but he's a very unpretentious, regular guy, if you will. And he has all this extremely cool, practical, utilitarian knowledge that he has. He trains people on this, and so it's been a lot of fun working with him. So that's a quick little piece of something else you can do with your son. So let's talk a little more then. So then you've been good since that time. Now, are you still having periods, or what's your situation? You're only in your 30s, right?
Just turned 40.
Oh, you did. Sorry. I was.
Yeah. Sadly.
Hey, listen. When you're as old as I am, 40 is not a big deal. I'm telling you. So.
Well, when it's your biological relevance, it's kind of hard.
Yeah, right. You're sort of looking at yourself. You know that you're an adult now, you know? Yeah. So, so your periods, are you still having your periods, or are you perimenopausal?
I do. Oh, my God, yes. I still have my periods, and yes.
So are they regular, or are they troubled, or what's going on with them?
No, they are regular, but I am cautious or nervous. I'm nervous about when I go through menopause, knowing how I react to sudden changes in hormones.
Mm-hmm. Yeah.
And knowing that a lot of women who had pregnancy or postpartum depression are at risk for kind of hard menopause.
Yes, very much so. I mean, it was one of the reasons I was asking. I mean, the last number you told me was 32, and that's back when that was going on. But it's something to think about, because that's got to be very likely. I don't know. I haven't seen your movie, but tell us a little bit about the movie that you wrote, directed, and produced, Dark Side of the Full Moon, and let's talk about the meaning of that movie and referential to what we're talking about here. Wondering not only in terms of pregnancy, but does that movie cover issues of hormone changes in perimenopause?
So the movie features women from around the United States who slipped through the medical system during pregnancy and postpartum. And it talks to researchers and advocates and doctors across the country about this number one complication of childbirth that is the number one overlooked complication, where doctors are given the option if they're going to screen or pay attention to this. So we're really exposing, the film does this, this massive gap in care where 1.3 million women are falling through cracks, and how devastating it is for women and families and their children. And that it's a real call to action that we need to change the conversation around childbirth, that it doesn't always look like a Hallmark card, and we need to have social systems set up to care for mothers. We need to have doctors screening. We need to have psychiatrists trained in this. We need to have therapists who are trained in this. We need to have insurance plans that will cover these kinds of services. We need hospitals to be trained in how to look for this and how to appropriately care for it, because right now there are little pockets around the country that are doing things like in Boston and Los Angeles and Boulder, but there is a massive gap across the United States where so many women are suffering and families are really suffering, and it costs lots of money, and it's taking women years to get better, if that. And they might get chronic depression from this. And really, it doesn't have to get so bad, is what we found out, if they're given the right treatment.
Well, I think the numbers are on the overwhelming side. That's a very high number. Another thing, number that I found, and correct me if I'm wrong on this, because I was looking at some of your material, and I honestly couldn't remember if it was in your material or something else I read in preparation to talking to you, that 1 in 10 mothers have these problems with birth, and that 1 in 20 fathers have similar problems in adjacent to the mothers. Could you tell us, are those numbers correct? Is that your understanding?
You know, it's higher.
Oh, it is?
Sadly.
Okay.
It's 1 in 7 women, and it might be as high as 1 in 5. But 1 in 7 is the number that we have right now. So, so just imagine 7 women in a pregnancy yoga class. You know, one of those women is suffering. Or if you have a practice and you're an OBGYN and you have 100 women, you know, do the math. That's how many women you are seeing who are suffering or will suffer. And dads are definitely at risk, because if mom is failing, her mental health is failing, and dad's taking it all on, he is definitely at risk for developing, you know, being overwhelmed and having to care for everything, as well as they are also, you might not even have a wife that has it, and just the pressures that are placed upon families these days. The change of having a baby, and we're raising babies in isolation where, you know, the first time in human history, that's what we're doing. So men are becoming depressed as well. Yeah.
So the next question
it's a little bit of bias. Well, you know, I think it's such like the perfect storm. So you have like these hormone fluctuations, which we do talk about in the film, of what happens to women's hormones, how this is the highest they're ever going to go, and then they drop off like a roller coaster, like a cliff, right when they have a baby. So like it's just primed, and then you have other things crashing in, like being alone. We live far from our families, and then you have other things crashing in, like this expectation that this is supposed to be the greatest thing. So it's the perfect storm, really.
Well, apropos of your movie, you and I talked, and we're going to have on the show notes, when you folks are listening to this, the show notes will be up and available, and we're going to have an easy to remember link there on the show notes. So if you happen to hear this in your car, you won't have a big memory stretch to try to figure out what the YouTube video link is. But I'm going to prepare a link, and it's going to be called corebrainjournal.com/darkside. And that's going to be a video trailer on Dark Side of the Full Moon, so that you can prepare it's going to be there on the show notes, but if you're listening to this is something you just put in that easy URL, and it'll take you over to the video. And that'll be good. So the next question then is, where do we go from here? You've done an excellent job of talking with people about this. You're a stand-up person in terms of saying this is a very important overlooked issue. What are you actually doing? How can we participate with you in some way to get the word out, make it more familiar, and to help your message be heard?
I think a big thing to remember is to ask her. We want everyone to know that they need to ask a new mom how she's really feeling and how she's really doing, instead of, oh, how's your baby? Because everyone's focusing on that baby. It's taking the focus back to moms. And so if everybody in your listening audience can check in with those new moms in their life to say, I heard this thing on, Core Brain Journal, and I just want to know, how are you doing? And you will be surprised at what you might find out, and to direct them to help. Postpartum Support International has resources all over the country, so maybe we can add that link to let people know where to find help. But if you have OBGYNs or psychiatrists or therapists, really just to get educated, OBGYNs really need to be screening moms, and they need to know the therapists in their area they can send them to. And therapists really need to know how to treat these moms. And psychiatrists really need to learn what medicines that they can give these moms, because going cold turkey for these women isn't going to help. There's so much literature and evidence-based practices out there. I mean, just knowing that this is so common and we really need to pay attention to it is a big step in the right direction.
Well, it's an excellent example of what we talk about here. Is there's so many, the complexity is there, and the hormone system is one important system that has a profound effect on the mind. I mean, we know that because women do experience PMS.
Of course.
That's everybody knows about it. I mean, not every woman has it, but it's a phenomenon, is a very clear example of hormones affecting brain function and causing depression, anxiety. And we've had people in our office who really say they get psychotic. And really kind of what you had was certainly an unreal situation of you hanging in a tree. I mean, I wouldn't say you were psychotic by any means, but that's getting out far on the edge. And we've seen this happen with women a great deal. Because we ask the questions. It's like, if you don't ask the questions, they're ashamed of it. It's sort of like having an eating disorder. I don't want you to talk to me about my eating disorder because it's so shame-based.
Right, and I think it's really, doctors we find that OBGYNs, about 5% are actually screening women, and that's in the United States alone, 5%. So, just having these conversations with women, we talk about gestational diabetes with every woman. We talk about hypertension with every woman. So this is one of those conversations to have with your moms that this might happen to you, 1 in 7. If it does, come and talk to me. Like, normalize that and take the stigma out of it.
Well, let me ask you another question now, because we were talking a little bit about this before we started chatting. So you had an intelligent, aware psychiatrist get in and work with you closely. One of the things about psychiatrists is we're all worried about being sued for the problem of creating a problem during pregnancy with an SSRI. I mean, that is what's going on with the whole dilemma of treating individuals who are pregnant with antidepressants. People do worry about it, but here you were suicidal and they were still thinking we can't do it. So
right.
That's against the grain. If a person's suicidal, that's a reason to do some kind of intervention. Now, what about hormone treatment? Have you? We talked a little bit about hormone treatment previously. Yeah. My own perception of it is that a lot of individuals like this, including yourself, have a hormone problem that's susceptible and will be responsive to proper identification and measurement and treatment with hormone regulations. What's your opinion about that?
I had a doctor in LA who treated me with progesterone cream when I was a year and a half out from having my son. And I was organizing a TEDx conference. There was a lot of stress. I lost my period again for 2 months, and I started to feel panic attacks again and OCD thoughts again, and I didn't want to get back on the SSRI. He told me that he was going to give me progesterone cream from a compounding pharmacy to balance out my hormones, and I was to put it on my thighs every night. And I got my period again within 30 days, and the panic attacks stopped, the anxiety stopped, the OCD thoughts stopped, and I felt like me again. I believe in this 100%. Like, I have experienced it in my life. So I have felt relief from an SSRI, but I have felt relief from progesterone, and it happened really fast, and it was natural. So I have heard this, and I believe in it.
Well, there's an extensive literature on it. I mean, what am I, a psychiatrist, talking about hormone regulation for? Well, it's because I've read, I think I've read about 8 or 9 books on it, to tell you the truth, somewhere in the 7, 8, 9 range, because I had so many women coming in with these problems. I had no idea what to do with them, and I know that's where I became really interested in this subject. And one of the big reasons we're so fascinated and so much appreciate you coming on here at Core Brain Journal, because estrogen dominance is something that is frequently not recognized and frequently treated in a cookie cutter fashion. I've got a sort of pet peeve about ADHD medications being treated and people being treated in a cookie cutter way with ADHD medications. And I think this is the same thing that's happening with women. If you don't do the measurement correctly, then we're whimsically treating individuals based on symptoms alone and not really looking at the underlying issue at all. Now, did you have some testing for that progesterone cream?
I did before. I had the saliva testing, but I think where my saliva testing was done wasn't done very accurately, because that doctor who put me on the progesterone cream said that my progesterone was at a 0 and I had my period, so that doesn't happen in any mammal, something like that. Yeah. But so I did have the testing, but I don't think I might have been doing the spitting wrong. But the progesterone cream definitely helped. And this doctor told me that he used to be an OBGYN in LA, and told me that he would treat women with progesterone creams like secretly, because the other doctors looked at him like he was crazy to even bring it up. So women who were postpartum, and he found it to be 100% effective.
Yeah, I think the real issue in that, from my limited experience, and I'm not an OBGYN guy, so I can hear my OBGYN colleagues saying, why are you talking about this as a psychiatrist? But I've just seen too many people get well from the point of view of measuring it correctly and then doing something about it based on the measurement. And I know there's a debate going on, and I'm not going to enter the debate, and the debate is either blood testing or saliva testing. And
well,
go ahead, please.
Well, we were going to put this into the film. To make the film as powerful as we could, we had to really focus down on the message. But we were going to bring up this idea and look at progesterone creams and estrogen creams, and really there was like a big thing hidden within it, which is the FDA doesn't want to say that it's okay, and because you can't really patent this. And so there were some reasons that we were uncovering why this might not be the treatment that is the first one that people go to. And it had to do with money. I don't know if that's a great thing to add, but that's what we found when we were going to do it.
It's a great thing if it's authentic and real and it's your experience. That's what we're doing here. I mean, all it does is raise more questions. I mean, what's the solution if we can't treat somebody based on good science and measurement? I think the real issue would be just treating someone capriciously. Like, you sound like you have signs of estrogen dominance, so let me throw some progesterone at you. I mean, that is unacceptable in my book. But I think on the other hand, if it's measured accurately and you do a very carefully compounded substance and watch the person carefully with follow-up, what's wrong with that. And we see people rebound when they get the progesterone. If they've been estrogen dominant, they rebound and can actually have a period or two where they actually get worse. Usually it's just one period, depending on how bad they are. Or they actually like, oh my gosh, I'm worse now. But it's because that whole estrogen progesterone cycle amplifies once they start to get balanced. So good. Well, listen, we are running out of time here. I'm looking at the time and I'm thinking what an interesting conversation this is, and I appreciate so much you coming on board. Let's make sure that we give our listeners a place to go. We're going to do that corebrainjournal.com/dark side. I was back and forth whether I should do full moon or dark side. That's why I hesitated there for a minute. But I think dark side of the full moon, we'll just do dark side because it's the first part of it. So we'll have that. And are there any other places that you would like us to go to connect with you in some constructive way?
Definitely darksideofthefullmoon.com, or if you know a woman that needs help, postpartumsupportinternational.net has wonderful resources for women who are suffering.
Good. Those will definitely be in the show notes, and I really appreciate it. This has been a very interesting conversation. I think these kinds of conversations are absolutely mandatory because if you think about it, what is a psychiatrist doing talking about this? I mean, one of the things that's going on is what is a person, you're a person that's not an OBGYN person yourself, but you experience some real issues with people who didn't identify what the problem was. And thank you so much for coming on board and talking about intimate details of your personal life that others can share and will be hopefully inspirational to them to ask the questions more carefully and think more deeply about the nature of these problems.
Thank you so much for having me on and giving me a chance to tell my story.
Listen, we're going to meet again sometime, and I look forward to it. And I want to say thanks very much. We'll see you soon.
Awesome. Thank you so much.
Yes, ma'am. Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.